Good morning, everybody. It's nice to see all of you here this morning. We have some exciting information to share with everybody, so welcome. I'm Kate Keller. I'm the president of the Harvest Foundation, and we're really excited to share with you our studies today. So we're going to get started with that. In respect of sort of the time of the presentation, if anyone has questions, we'll take them at the end. Well, they will take them at the end to answer any questions you might have about this. Today, we are releasing 2 health studies that explore the health outcomes of the residents of Martinsville Henry County. And as you can see, well, they were up there. They're in the back. We have the 2023 Health Equity Perspectives and the Community Health Needs Assessment from the Health Department, and the How Well Do We Know Our Community report. And you're going to get to learn more about these today, and we're really excited about them. They're complementary studies that provide needed insights that can help develop programs or policies that address our unique health challenges. These efforts can include areas such as prevention, primary care, nutrition, substance abuse, mental health, and more. Local health data is critically important for several reasons. Data helps healthcare providers and policymakers plan and allocate resources effectively. It provides insight into the specific health needs and challenges of our community, enabling us to design healthcare services that are tailored to our population's requirements. Local health data highlights health disparities and inequalities within our community. And this information is vital for advocating for equitable healthcare access and addressing the social determinants of health that affect our vulnerable populations. So today I'd like to thank the Health Department and our partners of the Equity Collaborative. If you're a partner of the Equity Collaborative, can you stand up? I know many of you are in this room. So I'd like to thank all of these people and any of our workers who did out and did the studies, who walked out and interviewed people. Are you any of you in the room? Are they any of them in the room? The people who went out they're still out in the field. Our field workers who collected a lot of the data from our local community members. There were a lot of effort that went into creating these 2 studies, and so I'd like you to also thank Pamela Chitwood, who's the Population Health Community Coordinator from the West Piedmont Health District, and Cheryl Agee, who's the Senior Operating Officer at the Harvest Foundation, who both were the champions of leading this work for us, and of course Nancy Bell, who helps guide us all along the way. Pamela and Cheryl are going to share with you the highlights of these studies, and then share with you how you can learn more and how you can get engaged. Thank you.
About this data. These are compiled from a lot of different resources, and this doesn't just come from one unique method or one unique source as you're looking across your community. We were able to put together a lot of secondary data from a lot of organizations that you work with here in Henry and Martinsville. So I want you to make sure that you take into context, this is pulled from a lot of places for the report from both Harvest Foundation and from the Equity Collaborative. And we're so excited today to see a lot of our Equity Collaborative partners in the room, as Kate said, and to see all of this work that was done by the individuals of the Equity Collaborative coming into this one report out. And I know what was done by the Harvest Foundation and what was done by the Collaborative are such good companion pieces that are coming together to help us do this work. So we'll do a data report out that highlights some of what we have found. The people that live in Henry County and Martinsville are experiencing shorter lifespans. As you see, Martinsville has a 67.2 year lifespan, and Henry is low at 74.4 years. They're enjoying 8 years less of life than our Virginia average, which is 79.1 years.
In the deep dive study that we did that takes it down to a census tract, we see that life expectancy does vary across those census tracts, and that a larger share of residents who experience longer life also have obtained at least a high school diploma. Further, approximately 1/4 of households in the lower life expectancy tracts have incomes below 200% of the federal poverty level.
Digging into the health of our local citizens, hypertension is experienced by Henry County and Martinsville City citizens who typically make less than $25,000 as their median income, and they are less likely to finish high school. These citizens are predominantly African Americans, and they have higher rates of hypertension, which leads them to kidney disease, heart disease, and stroke, as well as even brain issues.
The census tract further confirms that the connection between poverty and many chronic health conditions. 5 of our census tract with the highest poverty rates, the data shows that 1 in 4 residents have diabetes, 1 in 3 have limited physical activity, and 1 in 2 experience obesity and hypertension.
Challenging rates are seen with infant mortality. In Henry County, we can note that 14.7 per 1,000 total live births are pronounced with birth defects, SIDS, injuries like suffocation. The lack of maternal pregnancy health leads to complications of birth and death of these infants before their first birthday. This is an alarming number of infants that are also pronounced with neonatal absentee syndrome. That's nearly 4 times the rate of the Virginia average. The state of Virginia has a 5.8% neonatal absentee syndrome rate. These births are attributed across our Virginia with dependencies and withdrawal symptoms. Martinsville and Henry each have a rate over 22% compared to the 5.8% that Virginia is experiencing. The teen pregnancy rate for Henry County is 25.5 per 1,000 females. The Martinsville rate is 62 per 1,000 females. Virginia's rate is only 17 per 1,000 females. Percentages of women who still choose to smoke during pregnancy is considerably higher in our Henry and Martinsville locations. Infant mortality is something that Martinsville and Henry County need to focus. There are an alarming number of our citizens who are living below the 200% federal poverty level. In our localities, 46.4%, or 29,000 people, are living well below the 2,000% federal poverty level.
We know there's also a very wide gap between the average median income across our census tracts, from as low as $23,698 per year to a high of $58,125, more than double the lowest census tract level. So there is a gigantic gap. The lowest census tract level to the highest is double. Ironically, these census tracts are found side by side in our community.
In our communities, there's a marginal difference in percentages between ethnic groups and race groups living in poverty. Their largest percentage of race groups living in poverty are white, followed by Black residents, then Hispanic residents. And looking at the age demographics, the most common population living in poverty are females. Their ages are 45 to 54.
While the percentage of renter-occupied housing in our community is slightly below the national average of 33%, we don't find that to be true when we begin to drill down at census tract within our community. Those communities that have a higher poverty level, a lower median income level per year, about 50% of those residents do rent each year. And we also find that about a third of that housing is substandard housing that they're renting. Also, the rent amount that they're paying often is much higher in a lower census tract income level than a higher census tract that has a higher annual median income level.
Our citizens need more access to healthy foods. A mass of 42.9% combination of the county and the city are in food deserts. This means there's very little access to healthy foods. That's 8 out of our 11 census tracts live in a food desert. The lack of access to healthy foods leads to obesity, leads to chronic health diseases, and in Virginia, there are 14% that are living in food deserts, not 42.9%.
When we drill down to a census tract level and began to look at that even deeper, we found that 9 census tracts in our community have very low food accessibility, which means that they're more than 10 miles from a large grocery store. We also know that in many of those communities, 1 in 4 people do not own a car or have means of transportation in order to access food outside of their community. Of the 19 census tracts in our community, 16 reflect child poverty rates at the national, that are above the national level, with census tracts with the lowest median income showing that 91% of children in that community are living in poverty.
Henry County has a 21.36% population rate of children that live in poverty. In Martinsville, there's a 42.73% rate of children living in poverty. Children living in poverty see that there are barriers created that keep them from accessing their health services, keep them from accessing healthy foods. They have little or no access to anything that helps them get above their poor health status. 42.73% in Martinsville have little to get above their poor health status. Fentanyl contributed 75.7% of our fatal overdoses here in 2022, and here in Henry and Martinsville. The reported deaths from opioids in Virginia due to opioids listed at 2,185 deaths, while non-specific to opioids, deaths listed at 472. These are merely the reported numbers. There are far more deaths that contribute to opioids, but they were not able to be reported because medical examiners could not do toxicology reports at the time of death. Commonly, we're seeing overdoses to fentanyl, and also now we're seeing overdoses due to benzodiazepine, benzos, tranquilizers. The overdose percentage in Henry County is leading in the top 10 for localities for fatal overdose numbers. As we continue to see data coming in, we do not want to be in the top numbers for the state of Virginia, but we will continue reporting the data as it comes. We'll turn it over now to Nancy Bell and a call to action for Henry County and Martinsville.
Pretty sobering stuff, yes? We're not here to depress you all today. We need a reality check, and what we hope you all will do is agree to help us as we move forward. We're forming 6 teams around the various topics we discussed today, and we are asking people here, people that aren't here that may be interested, to meet once a month on each of these topic areas. We're not going to solve everything at one time, certainly, but working together, we can make small steps to move forward. And that's the only way we're going to start the ball rolling, I believe, is through these efforts. So please, before you leave today, check out the back table if there's a particular issue that you're interested in, like childhood mortality or overdose. You don't have to know anything about it. Just help us over the next year as we look at what other communities are doing and some things that maybe we can do here to help the folks in our community. And by all means, use the data that we've provided to seek grant funds and other support for your projects that are working on these issues. Thank you all for coming.
So if you have any questions, we can take a few now, or what we can do is, if you've given us your email address, we'll be glad to take questions. We can send them to our email address. We've got it linked on the pages at the back. It's linked at our website. You'll get our email addresses when you click on the report. The VDH report has my email address on it, and I'll be glad to field any questions that you have around data or where our teams are meeting. And the Harvest Foundation has their email address on it, which again, they'll field questions about the data and information that's been posted there. If you have any burning questions, I'll be glad to field some of those now. Yes, sir.
Glenn Adams, the interim city manager. I think I really want to dive into the 62% teen pregnancy. I think it's not 62, you just said it. 62 per 1,000, which is...
It is, yes, sir. 62 per 1,000 teens, yes.
Which is 6.2%, not 62. So that's very important for this.
Yes, so the 62% that's given to us on there is 62 per 1,000 teens.
Okay.
Yeah, everything that we have breaks down into either per 1,000 or per 100,000, but it is per 1,000 teens. All percentages usually break down to counting out by 1,000 or by 100,000.
With the fentanyl overdoses and everything in our area, why is it specifically our area that has such a higher as opposed to like Danville and Rocky Mount and Floyd and all of those areas? Why specifically are we this concentrated sea of higher overdoses as opposed to these areas? Do we have higher demographics as far as this goes, or do we have less enforcement of policies, or is it just a matter of do we have more general drug use in the area and these are cases that are being laced with fentanyl, or are people actively seeking fentanyl as a next step up at this point? Why are we a higher area for these drug overdoses?
Can I take that one?
Absolutely.
That's what
You
we're
may
going to find
have to-
out.
Yeah, so that's what I was actually,
So why and how we can fix it is part of the work going forward in the next year.
Yeah. So what we're doing in looking at fentanyl overdoses is we have lots of data. And we have lots of information that tells us about fentanyl and about overdoses, but the why is where we want to break it down into these groups and look at it. So we'll be glad to provide state data and all the information about overdoses. But what we need to look at is exactly what you said. So please sign up for one of our groups and come help us find the why.
And I guess a follow-up question would also be, are areas around us looking into fentanyl use as adamantly as Martinsville and Henry County?
Yeah, you're hearing a lot of buzz like we're putting out in a lot of different areas. Everybody wants to find that why. Yeah. We have some folks in the room that are on our Equity Collaborative, and I can see them buzzing because they want to have you at their group table discussing that. Don't worry, they're going to tap you on the shoulder in a minute and go, come work with me because I want to discuss that. So again, we're putting together those work groups, and the way that we find out answers is by working together as a unit to find these answers and to find how. You know, it's a great thing when we can all work together to find solutions. Any other questions? Thank you all again for coming.